So you tore your ACL and you want to know when you can get back to play. Let's break this down. So what happens when you tear your ACL? Well, the ACL is a ligament in your knee that connects the femur bone to the tibia bone, and it prevents rotation and translation, twisting and bending in certain planes. Most of the time you hear a pop and then it swells up and the knee just doesn't feel right. You lose range of motion and there's significant pain. What are some common causes of ACL tears? Well, the most common is a non-contact injury. That means you haven't been pushed or nobody's knocked into your knee. It can be an awkward land, a twist, and that's the most common. It can also tear with direct contact, but that is not as common as the non-contact cause. What are the surgical and non-surgical options for ACL recovery? Well, non-surgical consists of rehabilitation and bracing. Typically in the office setting, it's a lower demand patient that does not want to return to twisting, high demand activities. Maybe lower demand, more computer oriented or something like that. In terms of reconstruction, this is typically for people that want to get back to sports, twisting activity, jumping and running. A full reconstruction recovery typically takes longer than the rehabilitation only portion of treatment. What are surgical and non-surgical options for a torn ACL? Surgical options are full reconstruction, typically using your own tissue, sometimes a donor tendon. Non-surgical options are bracing, physical therapy, and range of motion activities. Why do athletes require reconstruction most of the time? Well, typically because the demand on the knee. The ACL prevents that rotation and translation in certain planes of movement. And if an athlete puts demands on their knee will be at risk if they don't have the ACL. It's important that the ACL functions so when that patient lands or the athlete lands and twists, it doesn't allow that knee to buckle and cause further injury. What does the entire rehab timeline look like for an ACL reconstruction? It varies per patient. Typically, it's 9 to 12 months, but it depends on the patient's strength, mobility, core muscle strength, and also the feedback from the physical therapist. The surgeon performs the surgery and guides the patient on recovery, but the physical therapist also gives feedback to the surgeon and the patient, oftentimes putting the patient through tests, mobility, single leg hop, plyometric activity. It's not always cut and dry, but the general range is 9 to 12 months. What's the real answer when it comes to return to play? Well, 90% of patients return to play. That is the book answer, the academic answer. If you had your ACL done in New Jersey or California, you're looking at about a 90% success rate of getting back on the field. But it does depend on the health of the patient. Before their injury, were they in shape or not in shape? After, were they compliant with physical therapy? And how do they compare to the other knee? Are they as strong? Are they 80% as strong? And have they been put through appropriate rehab and recovery so that they can return at the appropriate timeline? What does the rehab look like? Well, it's in phases. And typically the first phase, you're dealing with swelling, pain, some bruising, and the physical therapist will assist with range of motion, elevation, and home exercises to help you get the swelling out. So restoration of motion, get the swelling out is the typical goal for the first few weeks. The next phase is gentle strengthening and controlled exercises. The ACL at about 6 weeks is pretty delicate, so we don't push it too hard with heavy physical therapy. There's modified programs called closed chain exercises that make sure the graft is protected. After about 3 months, if all is going well, most patients can run in a straight line. Plyometrics, which are side-to-side activities, jumping, box jumps, things like that, more or less happen between 4 and 6 months, depending on how that knee reacts to the first 3 months. After that, there can be guided sports-related activity, typically not 5-on-5 or 3-on-3, but very light drilling. And if the knee responds well with regard to swelling, range of motion, then the activity is advanced. So what test do I use to determine whether an athlete is ready? Well, general rule of thumb is range of motion has to be near perfect, minimal swelling to no swelling, full strength, and no pain. In addition, feedback from the physical therapist, making sure that this individual has passed all of their plyometric tests with no recurrences of instability or pain and swelling. In addition, there's physical exam findings like the Lockman maneuver, anterior draw, making sure the graft isn't lax. There's also testing the core strength and quadriceps and hamstring strength to make sure everything is okay. Why is mental readiness as important as physical readiness? Well, in order to compete, one has to be confident in their knee. If you had an ACL reconstruction, it's traumatic injury, and oftentimes the athlete might be worried about a recurrence. Oftentimes you'll see professional athletes take a year or more to come back, and it's not just the physical part. It's very hard to recreate the on-field activity in a therapist's office or a doctor's office. Once you return to play, it really is how the knee reacts and how confident you are. I think if you have confidence and the knee shows you that it's stable and you're able to perform at your pre-injury level, then you typically go on to do very well. One particular athlete was a collegiate basketball player. She originally tore her ACL in high school at age 14 and had a reconstruction performed. Because of the motivation and stick-to-itiveness with physical therapy, this patient went on to have a celebrated career in Newark, New Jersey, and played Division I basketball at a very high level. What would I tell someone if you just tore your ACL and you want to know what your options are? Well, I think age is a factor. If you're younger, making sure you're done growing, or if you still are growing, you have to ask your surgeon if the technique has to be modified and how much growth you have left. If you're more high demand Division I athlete, professional athlete, typically those athletes go with a bone tendon bone autograft, which is a special type of ACL reconstruction, the gold standard, many would say. If you're older, slightly lower demand, and you want a faster recovery, you could consider what we call allograft, which is a donor tendon. That's where we don't harvest tissue from you and we take it from a tissue bank that has the tissue verified. It really is a discussion you have with your surgeon, and hopefully he or she can give you the answer you're looking for. An ACL tear is a devastating injury. Many people are intimidated by it. It can take upwards of a year to recover. There's also a mental component. My suggestion is, if you have any questions about ACL tears, you want to know more about it, if you want reconstruction options, here at Modern Orthopedics of New Jersey, we can answer those questions and give you the confidence you need.